Thank you very much. Um, I want to extend my congratulations to Dr. Mishra and to the members and alumni of the department. Thank you very much for inviting me to share this wonderful celebration with you. Dr. Mishra, with your help, has built a powerhouse of a tertiary endocrine surgery center that has provided excellent care to patients and training for the next generation of endocrine surgeons. When Dr. Mishra invited me to give this talk, I asked him what topic he had in mind. He was very clear. He wanted me to address my talk to the younger generation of endocrine surgeons about who we are, where we came from, where we're going to, our purpose. Why do we do what we do? I was talking to a surgical resident the other day while scrubbing for a case, and he was still choosing a specialty and asked me, why do you do what you do? Why endocrine surgery? The disease is intellectually challenging. The operations are delicate and fun, and we make people feel better. I went on and on. I can't imagine a better specialty. It gives me joy to be an endocrine surgeon. Now, here's my Twitter page. Social media, especially Twitter, frequently forces to distill complex issues and nuanced discussion into simple, declarative, unambiguous phrases. So when I pick my Twitter handle, I define myself professionally as that endocrine surgeon from San Francisco. So who am I? When is it all distilled down? This is how I describe myself. It is relatively self-explanatory. I'm an endocrine surgeon, general surgeon, and a laparoscopic surgeon. I love science and I believe in humanity. And now I explain the last line just briefly. I was born in Taiwan. It is an ancestral home of the Pacific Islanders. The Polynesians are descendants of the original Taiwan people. Here's a brief history of Taiwan. It was initially colonized by the Portuguese, Spanish, and Dutch, but immigrants from China predominated, so Taiwan became part of China in the 17th century. China declined during the mid-19th century and lost many wars and territory to the Western colonial powers. And it lost a war with Japan and lost Taiwan to become a Japanese colony. When World War II ended, Taiwan returned to China, and after Chinese Civil War, it became the only province that was controlled by the nationalists. My parents immigrated to Brazil when I was 9. My father was a businessman, but eventually became a fazendero, a cowboy rancher with 5,000 heads of cattle in the Pantanal region of southwestern Brazil. My brother now takes care of the cows. Separately, at age 15, I moved to Washington, D.C. for high school. While in high school in Washington, D.C., I was adopted by my Greek-American family with whom I have remained very close. And so that is why I identify myself as a Taiwanese, Brazilian, Greek-American. Now, enough about me, how about us? What is endocrine surgery? Who are endocrine surgeons? This book, The History of Endocrine Surgery, was written in 1990 by the late Sir Richard Wellborn. It describes in details how endocrine surgery evolved. Currently, most endocrine surgeons take care of patients with hormone-secreting organs, thyroid, parathyroid, adrenal, endocrine, pancreas. And in essence, endocrine surgeons are endocrinologists who can operate. Now, thyroid surgery has been done for more than a millennium. This is a well-known description of thyroid operation from Salerno in Italy in 1170. Frugati described how to remove a goiter. They used setons, similar to what we do today for anal fissures. The tracts were first created by a hot iron rod. Then setons were inserted and tightened slowly to cut through the goiter. If the goiter is pedunculated, like this drawing by Coker, then a bootlace is used to tighten around it, again, to cut it off slowly. Sounds very painful. And of course, being a Chinese, I should tell you that even 1,000 years before, during the 2nd century, surgery was being performed in China. This is Hua Tuo, the founding father of Chinese surgery, extracting a poison arrow from the famous warrior general, Guan Yu. Although thyroidectomy was done in the 2nd century China, the results were apparently dismal. Cao Cao, one of the kings during the Three Kingdom period of China, advised one of his generals not to have a thyroidectomy because 9 out of 10 people who had a goiter operation died. I will not attempt to tell this audience about the history of Indian surgery or the goiter surgery in China, but I would assume that goiter surgery was also already being practiced in India during the same period. Similar to the Chinese, thyroidectomy was also done by the Romans in the 2nd century. Galen knew about the problem of voice loss from goiter surgery and described the anatomy of the recurrent laryngeal nerve. He was known to put up a show, silencing squealing pigs by disrupting their vagus nerves with his finger. Of course, we all know Theodor Kocher, the father of modern thyroid surgery. He won the Nobel Prize for his work in physiology, pathology, and surgery of the thyroid, and set the foundation for thyroid surgery as we know today. Now, what about the parathyroids? The one-horned Indian rhino is a mascot of endocrine surgeons all over the world. You can see here, during the COVID pandemic, we wear masks with the Indian rhino to identify ourselves as endocrine surgeons. We all know the story of Sir Richard Owen, who was the first to describe the parathyroid glands in the Indian rhino that died at the London Zoo. But you may not know this. Journey to the West is one of the best-known Chinese classic literature. The Chinese monk Sanzang traveled to the West, to India, to search for the sacred Buddhist texts of enlightenment. The 3 demons that he encounters were Indian rhinos that disguised themselves as local gods. Now, but enough old fun facts. What about now? Our modern heritage started in San Francisco in 1979, when the International Association of Endocrine Surgeons was born. The IAES was a vision of Norwegian surgeon Peter Hyman. He wanted to organize a group of like-minded endocrine surgeons into an association, but died prematurely in 1978. His dream was realized by his friends. Since 1979, the IAES meet biannually. The meeting rotates through different continents. The last one was in Basel, Switzerland, and next year's meeting in Kuala Lumpur is delayed because of the pandemic. The American Association was born at the same time as the International Association at its first meeting at Ann Arbor, Michigan in 1980. It meets yearly, and I have had the pleasure of hosting it twice with Dr. Clark, once in Napa Valley in 1996 and once in Monterey in 2008. Professor Fujimoto organized the Asian Association during his IAES presidency and had the first meeting in Tokyo, Japan in 1988. I remember going to the 3rd meeting as a young surgeon when it was in Taiwan in 1992. And I have been to 10 Asian Association meetings since. Well, there was a lot about who we are. Let's talk about the joy of being an endocrine surgeon. The first and foremost is the joys we get from caring and serving our patients. I agree with many religious leaders and behavior scientists that people are fundamentally good. The urge to do the right thing for our fellow human is baked into our evolutionary inheritance. It is our nature to want to help others. There's no better job than to be a physician surgeon, where our knowledge, skills, and compassion can help alleviate suffering, calm fear, and inspire hope. Over the last 40 years, I have cared for tens and thousands of patients. I've cared for Silicon Valley CEOs, Nobel Prize winners, movie stars, prime ministers, and royals. I've taken care of gardeners, bus drivers, dishwashers, and farm workers. And I've taken care of prisoners, outcasts, undocumented, uninsured, and homeless. Throughout this time, I've derived the same joy in having the privilege to help care for and serve another human being. The joy derived from helping another human being transcends all political, religious, economic, and social boundaries. Simply put, it just feels good to help people, especially you have the expertise to do it well. Now, another deep joy that we feel as endocrine surgeons comes from learning new things and from teaching others what we know. Confucius is epitome of a teacher in the Chinese culture. He taught us to ask questions and to follow the golden rules of treating others as you want to be treated yourself. Socrates is epitome of the wise teacher from the Greek culture. He was considered the wisest of the Athenians by the Oracle of Delphi because he knew that he did not know. And so he needed to strive to learn. Now, speaking of the Oracle of Delphi, as endocrine surgeons, we all know the prelaryngeal nerves are named the Delphian nodes because they foretell the future of the patient with thyroid cancer. Coker is another wise teacher, a cautious endocrine surgeon. He said, "A surgeon is a doctor who can operate and who knows when not to." Here's another wise surgeon teacher who has taught us when not to operate. Professor Miyauchi of Kuma Hospital showed us that many patients with microcarcinoma of the thyroid can be safely monitored and do not benefit from surgery. I had the privilege of editing several textbooks with my mentor, Dr. Clark. Some of you in the audience have contributed to these books. Thank you. The purpose of these textbooks was to teach students, residents, and young surgeons about endocrine surgery. However, I have learned way more about endocrine surgery, reading and editing from the contributors than you may imagine. The joy of operating. Operation is a privilege that makes being a surgeon special. For most of us, it is a passion that drives what we do. The operating room is full of history of thyroid surgery. Here are what's in my thyroidectomy tray set. I use a Leahy retractor to hold the strap muscles away from the upper pole, the curved Coker to hold the peanut for blunt dissection, the Mayo to spread in the avascular plane of Reeves, a cryo to dissect the superior upper pole vessel, and a mosquito or Halstead to clamp the sutures. Now here's another whole field of studying knots. Surgeons learn how to tie knots from fishermen and farmers, but the knots we use are some of the most basic knots. A good fisherman would laugh at us on how primitive our surgical knots are. Of course, we don't tie them anymore. Most of us use ligatures and harmonics. Here's some of the operations that my friends and colleagues have taught me. They're fun to learn, and even if I don't know them, if I don't do them anymore, learning them have taught me how to change my routine operation. This is MIVAT from Paolo Miccoli. I learned that I can make my incisions smaller and my dissection more precise. This is Woon-Yoon Chung's transaxillary robot-assisted thyroidectomy. I went to learn from him in Seoul, Korea. The robot is fun to use, but I'm not quite sure whether it's worth the trouble. Here's me learning how to do transoral thyroidectomy from Ankun Anuwan in Bangkok. I help now my partner Insu Se, who does this operation at UCSF. Here's an imaging-assisted augmented reality parathyroidectomy that was developed by my friend Jacques Mariscal in ERCAT in Strasbourg. And this may be the future. The joy of discovery. Surgeons are scientists. Much of the joys of being an endocrine surgeon is discovering new knowledge and developing new treatments. This is how Coker discovered the importance of thyroid hormone even before it was chemically identified. This is a famous picture of the two sisters. Picture on the left shows the taller 11-year-old with a 7-year-old sister. On the right are the sisters 8 years after the 11-year-old had a total thyroidectomy. Her hypothyroidism has stunted her growth, so she was now much shorter and slower than her younger sister. Coker learned this and stopped doing total thyroidectomy after this discovery. Here's another new discovery that may soon change how we operate. By using near-infrared autofluorescence to help us identify parathyroid glands during the operation. And we are beginning to use some of these technology. Speaking of the joy of discovery, we currently have an exciting project at UCSF on improving islet cell transplantation. The current technique of islet cell transplant is limited by the poor survival of the islets, so it requires multiple donors and does not have good long-term success. At one of our resident research day, after hearing the transplant surgeon's complaint, I mentioned that we seem to have little issue with parathyroid glands. We can easily auto-transplant them. And in fact, we even seem to have the opposite problem with overgrowth of parathyroid tissue with parathyroidosis. So I suggested that perhaps we should use the parathyroid tissue to help the islets. Casey Ward, one of the residents, decided to try out the idea, first in vitro, then in vivo. To our astonishment, co-transplanting parathyroid tissues with islet cells seem to protect them and keep them surviving and secreting insulin much longer. You can see from the chart here of the red lines where the glucose of the rats that the mice that we transplanted to continue not to be diabetic. The parathyroid tissue promotes growth of new vessels that appear to be generated from both the recipient and the donor. Such robust response was able to keep the transplanted islets well vascularized and healthy. So we now currently have just started a clinical trial to co-transplant islet and parathyroid tissues in patients with type 1 diabetes. If this works out, it may make islet cell transplant much more successful and practical. This is me helping the transplant surgeons removing the parathyroid gland from a deceased donor in the middle of the night. Now, the joy of friendship. There's a friendship with our colleagues, and I believe it was Norm Thompson who famously said, the endocrine surgeons are the friendly surgeons. Here are the pictures from some of the Asian Association meetings, including the one in New Delhi in 2018 that I remember fondly. Some of you may recognize yourself, and as well as Dr. Mishra in the middle there, giving his lecture. On the right are the pictures from the most recent Asian meeting in Melbourne. And that was the last international trip I took. It is a special treat to see, to hear, and to talk with our endocrine surgeon friends and colleagues. This is Dr. Clark's last operation. Wen Shen and I had the honor of assisting him. Atul Gawande, who happened to be visiting in the OR at the time, took this picture. We treasure our friendship. Here are my UCSF colleagues. There are numerous students and residents and fellows that have supported me through my career in endocrine surgery. And they are the major source of the joy that I found in endocrine surgery. So to conclude, it is a great privilege to be an endocrine surgeon. We have a wonderful history and many good stories. We have joy because we care for our patients, we learn and teach, we operate, we discover, and we have great colleagues and friends. And congratulations again to Professor Mishra and your department. And thank you for inviting me to celebrate your Foundation Day with you. Thank you very much.